So welcome back, everyone. My next guest is Gail Curran, and she is the owner of Optimal EDU Options. Welcome to the show. Please tell everybody a little bit about yourself and what you do.
Sure. Thank you, Carol. I'm excited to be here. I'm an educational and therapeutic placement consultant, and what that means is when families are struggling with their children, could be as young as 9 years old, could be as old as 26 years old, and community resources are no longer a choice. They call me and they ask for help.
Okay, so when you say 9 years old, I didn't know it started at 9, but you know, it does sort of, right? And us parents know that. What are the kinds of things that you mean that they're struggling with that they would call you for?
They are struggling in school. They may be refusing to go to school. There's a lot of anxiety and depression. There could be mental illness, learning disabilities, autism. I work with a lot of kids that have been adopted, both international and domestic, and everything that the parents have looked for in the communities, such as professionals and the school system, and where they're attending school or going to therapy is just not working.
Right, and it does happen like that. This is where it's really you've probably gone the furthest extent, and you're just out of your wits.
Yes, I am the last people they call.
Okay, so
yep, they're at the
but
end
it's
of their
interesting
wits.
Though. There's so many people out there like that, and I know that, unfortunately. So okay, but you did tell me today that you specialize in children that are adopted, though they don't have to be. I want to get that clear.
Absolutely. I have a master's degree in human development and family studies, and my thesis was on attachment and trauma. So I go to a lot of conferences. I read a lot of books. It is my wheelhouse, as well as special education.
Okay, so now let me ask you this, a couple of different things. First of all, obviously we know who your client is. When is the best time for them to call you then?
When they've run out of options in the community.
So they do not call you when they first see any signs. They know they've got an issue and they need your help. They need to call. Now, this is something that when people are listening to this, what I like about networking is maybe it's not you, but you might know somebody in that situation, and that's what I like this show about. Now, you can call her direct. She does free 30-minute consultations. Her phone number direct is 602-904-1282. Now, also, her website is optional, EDU Options with an S.com. She's also rated with the Better Business Bureau. And when people call you, you told me that they don't necessarily need a referral. That they don't necessarily, they can go on your website, they can find you and call you.
Absolutely. 85% of my clients come from referrals, such as psychologists, psychiatrists, and mental health professionals in the community. About 5% come from my website, and then the rest come from family referrals who have hired me.
Right. Or if you hear something like that, that's why I want to say it that way, because yes, most of them do get referred to you, though you don't have to. So that's why you can go up on her website. You said that they can actually sort of go online, and what do they do?
Yes, they can go to my website, and on the contact page, there's a form that they can fill out. After they fill that out and send it, I will contact them and set up an appointment for that 30-minute free consultation.
Okay. Now, again, that website is optional, EDU Options.com, rated with the Better Business Bureau. Her number is 602-904-1282. So why should someone hire a educational consultant?
Okay, and I visit about 35 to 50 programs. I vet them, I evaluate them throughout the United States. So when a family hires me and I get to know the family and the child, I read their psychological reports, their educational reports, and I'm best able to match that child with the program that matches the child's needs. There are a lot of programs out there. There are a lot of schools throughout the United States. It can be very overwhelming for our family, and so I'm able to guide and assist and advocate on their behalf.
So I love this. Now I get it. So in other words, if you had somebody out that you had to place in a home, you might want to go to someone that you would call that would help you with that. This is something where if you have a child out there, and there could be child up to what age?
26.
26.
We work with young adults as well.
Okay, and you're just at your wit's end. You've gone all the way to the furthest extent. She can call. You can call her. You'll do an assessment. Then you'll know through the different programs that are out there where that child would fit best. Is that correct?
That is correct.
Okay, so and you said to me that you work with people internationally.
I do. It's few and far between, but I have worked with families internationally.
Sure. So now, but valley-wide for sure.
Throughout Arizona, as well as throughout the United States. I have offices in Peoria and Tucson.
Okay, and so again, that website is optional. EDUoptions.com. That phone number is 602-904-1282, and she'll do a free 30-minute consultation. And again, she works with anyone. She's also rated with the Better Business Bureau in terms of, when I say anyone, anywhere in the Valley. Okay. All right. So, and you kind of said your qualifications, but did you want to go into that a little bit further?
Well, for probably more than 25 years, I have worked in private residential treatment centers and therapeutic boarding schools. I have a master's degree in human development and family studies, as well as a master's degree in business administration.
And so what kind of schools do you work with? Any school?
I work with, sometimes it's a wilderness program, sometimes it's an assessment program, sometimes it's a traditional boarding school, a therapeutic boarding school, a residential treatment center. Again, it all depends what the child needs and what the family is looking for, and I help guide them.
So when you said a wilderness, I'm just giving this as an example. That's a pretty different kind of thing. So some children don't belong in a traditional school setting. Is that correct?
That is correct.
Okay. And again, you've worked with several. You said, how long have you been doing this? 25 years?
I have been an educational and therapeutic consultant for 5 years. Prior to that, I worked in schools, therapeutic schools and residential treatment centers.
Well, this is something that I love talking about because I think it's not talked about a lot.
No, it is
And
not.
there's a lot of people out there that are dealing with issues. And again, if it's not you, but it's someone that you know, please give them this information because those parents that are dealing with that are usually pretty at their wits' end.
They are.
Right. And even I would think that the child might be also.
Yes, because he may be refusing to go to school, unable to get out of bed, just struggling in every aspect of his life. There may be some substances, addictions, just really spinning out of control types of behaviors.
Well, it's sad, but you know what? There's people out there that could really use your help, I'm sure. Again, that phone number to call direct is 602-904-1282. She does do free 30-minute consultations, rated with the Better Business Bureau. She is valley-wide. She has offices in Peoria and Tucson, and the website, again, is optional, EDUoptions.com. So what is it? I'm sorry?
It's optimal, not optional.
So it's optional. What is it?
It's optimal, EDUoptions.com. So OPTIMAL, EDUoptions.com.
Oh, I thought, okay, so I'm going to let you do that the next time because I wrote it from here. But anyway, so let me ask you this. What steps do those parents take? What do they do?
Well, the first step is they can either call me or they can go to my website, fill out that contact form, and I will get in touch with them. We have that 30-minute free consultation. I listen for a good 30 minutes, and then I spend a few minutes on how my practice works. So the next step would be an initial consultation, which I like to do face-to-face, and I also like to do it in their home because that is comforting to the child as well as the parents.
So and what happens, let's say, usually I'm going to say that you've done this long enough where when you're working with that child, you kind of know pretty much right away where they need to go. And so what has been your I don't want to say what has happened most of the time when you've gotten those child into the school that they need to be in? What happens then usually?
That's a great question, and I'm so glad that you asked it. It's I stay with the family for a year or more. So my contract is a minimum of a year, and as long as the child or student is in a school or program, I become part of the treatment team with that school and program, as well as an advocate for the child and a support system for the family. So I stay with the family.
Wow.
for a year or more.
So, and you stay with them, do they come to you like on a how many time basis? Is that how it works?
Sure. So, for example, if it's a wilderness program, that's usually a 3-month stay. I will speak with the therapist in the wilderness program weekly, as well as speak with the parents weekly, as long as that child is in the wilderness program. And then when that child comes home, I help with the transition. So I wrap services around them. I find the doctors that they need, the therapists that they need, etc. So I stay with the family. I am their advocate.
Wow, this is awesome. Again, maybe it's you. Maybe it's someone you know that might be dealing with a child that might be dealing with something like this. The parents that might be, they're out of their mind now. They can't take it anymore. They need help. The number to call her direct is 602-904-1282. It's Optimal, EDUOptions.com. She's rated with the Better Business Bureau. Again, give her a call, 602-904-1282.